results and talking with people about our model, really bridging the creative community with public health. And people would come up to me afterwards. They know every show in the series of Law & Order SVU or in Grey's Anatomy. They know them better than I do. And so these shows are being watched. And I remember asking some women in Oman why they watched these shows. And they said, Sandra, this is the only way we can learn how justice is delivered or how healthcare is delivered. And they do watch the programs. But what Hollywood Health and Society is doing in partnership with the World Bank is we're going to set up a network of centers for entertainment education like Hollywood Health and Society, but in the major media markets around the world that serve developing countries. So we're looking at India, Egypt, South Africa, and Brazil, and eventually Mexico and Nollywood, Nigeria. Because we know that there are many campaigns and there are many individual soap operas and programs around the world that have social content. But we don't know of any sustained and systematic models of outreach the way we have, which are actually very inexpensive, but to provide on an ongoing basis accurate content on development issues, whether it's health or conflict transformation or finance or the environment. And so that's the model we're moving to. And we envision having a network of centers with the hub in Hollywood, because every creative community in the world wants a connection to Hollywood, because Hollywood does it best or really well. So to set up partnerships with writers and others so that the network can kind of feed it, nurture itself and each other. So that's our plan.
New media, for instance, as I said earlier when I was speaking about the documentary and how we, and about the show and how we use Twitter, for instance, but new media has a huge and profound place for health storytelling. In India, for instance, where culturally it may be still somewhat a taboo to discuss sex education in the home, the Indian cell phone company has provided games, video games, where young people can go on for free and learn sex education. And so this is all happening. And if you go to a book called Design Revolution by Emily Pilliton, she shows 100 different design innovations, and that's one that are changing the world. So you can just imagine, as I said before, 1 out of 3 people have cell phones in Congo. Women use cell phones in Congo to inform each other where rapes are occurring. So mobile phones, really beyond laptops, because everybody doesn't have a laptop. We don't have the satellite structure yet to connect everybody through laptops, but mobile phones, yes. So that's where we have to really start thinking, how can we do that? And then I could take a clip and embed it on a mobile phone, for instance. So there's a lot of very interesting work going on where storytelling can lead the way on mobile phones.
Sally.
I think also that the concept of new media really has to be taken also to the individual level. Someone once told us that no one should go to Africa or the developing world without a flip phone. So to the extent that you can have, we've been toying around with the idea of having a living proof channel on YouTube, so that anybody that wants to go and put up their own story can. That can go viral. I mean, I think what we've learned in the past now, several months, with respect to things that are happening around the globe, is that once that goes viral, it goes pretty fast. Yeah. And so to the extent that we can tell stories and that our partners can tell stories and people on the ground can tell stories, and that can be uploaded via camera phone or what have you, I think that there's a lot of opportunities there that we have to be willing to take a gamble on.
Who's next? Yes.
Hi, my name's Riley. I recently started at Georgetown School of Foreign Service, and I'm studying media and politics. And I was wondering what you think could be done specifically in Hollywood for executives and writers and actors and actresses to sort of convince them to incorporate these global issues of health and development in maybe like younger shows like Gossip Girl that have a hugely young audience.
Well, that's actually our job at Hollywood Health and Society. So, yeah,
that's what we're trying to do.
That's what we're working on. So what we've been doing is holding panel discussions at the Writers Guild of America West. We have a partnership with the Guild. The president is actually the co-chair of our advisory board with Neil. And we bring in experts on global health, and we bring in people who can tell real stories, so that they're real stories of real people and case studies, and this is what inspires writers. If you want content in TV storylines for any age group, you've got to work with the writers. You know, people often think of celebrities, and Mariska is unique, but you know, it's really the writers behind the stories who are creating this kind of content and have the power to put global health into a storyline. So that's our primary audience. You know, it hasn't been that easy. I think, from my experience with writers tend to write about things they know, they've experienced, they care about. So you've got to really inspire them, and to get someone to really understand what it's like in a developing country when they haven't been to a developing country is a challenge. So we are actually working to set up, we've got some other things. I don't think I'll talk about them right now because the deals aren't quite closed, but we have some very exciting new ways of giving, let's say, writers direct experience of developing countries. Read between the lines.
Yeah.
Okay.
Yeah, I think that's, I mean, one of the things that we hope you do, I think firsthand experience is incredibly important. We found that through members of Congress here, through people that are policymakers who were skeptical, that didn't know what was happening, or just it wasn't on their radar screen, taking them to the location, taking them to clinics, taking them to places of conflict, I think is a profound experience, and it changes you forever. I can't tell you how many people that we've taken on a trip, or that I've gone on a trip with that came back and said, what can I do? It's probably the singularly best way to invest money in terms of trying to change people's minds.
Thank you. You're next. Could we have a microphone up here, please? Thank you.
Good evening. I'm a pediatrician, okay, past president of the American Academy of Pediatrics, and one of the stories that I think needs to be told, and maybe it already has begun, is about vaccine preventable diseases. Mm-hmm. I think the difference in what's happening in the U.S. versus what's happening in the global community is just unbearable for someone who knows about these diseases. We are getting so many vaccine refusals, people who have never seen these diseases, where when you go overseas, you know that about 250,000 children over abroad die from measles, for example, from the complications of measles. And so this sort of contrast in terms of people refusing help versus what's happening in the global community, where we need to get more vaccines to children, is certainly something I hope you can think about how to work into a story if it hasn't already been done.
We did it last year, right, with Hillary Duff. We did a story about, we like to ask questions that are the basis of our show. So we asked the question, what is a parent's social responsibility to vaccinate? We know that a lot of parents have various points of view about vaccinating their own kids. But what happens when you don't vaccinate your child and your child comes down with measles? And in fact, Mariska's husband, Peter, who's an actor, was the lawyer in that episode with Hillary Duff. What happens when your child exposes another child who, in this case, was a 10-month-old who can't be vaccinated? She was too young, and that child dies from measles. And we had data about the last measles epidemic in the United States, where 123 kids died between 1989 and 1992 or 3. So we just put it out there for people to talk about, because they have very strong issues, or strong beliefs in the United States. But it's also, you know, we haven't done it on an international basis. But I imagine we could, because people come in with various, you know, if someone came in with polio, say, into the United States. But the good thing, as I said about our show, is that it's repeated a lot. So I bet if you over and over on USA. So I bet if you.
Oh, they know.
So if you went on YouTube, and you went SVU and Hillary Duff, and we purposely cast Hillary Duff. I mean, that's like the little, you know, I figured, how do I get like young people to watch this episode? Well, I'll cast a young icon. And so it got a lot of attention. People didn't agree, but they, you know, as everyone has said, they talked about it. And they talked about, gosh, what is my responsibility? I know what I feel about my own kid, but it broadens the thinking a little bit, and it's tough. So we have done it, but it certainly can be done by many, many shows.
And on an international basis.
Right.
We like that
Just,
idea.
I think one point here, vaccines is actually, the vaccinations are the cheapest way to save a life in the developing world. Bill and Melinda just recently announced at Davos a $10 billion commitment over 10 years to vaccine development and distribution. It is one of the most important things that we can do. And this is, they wanted to have this next 10 years be the decade of vaccines. And I think that we really have to take this seriously. It is absolutely one of the most inexpensive ways that we can save lives.
Okay. So this woman here and
my name is Umra, and I have a question as to addressing the harm side of some of these initiatives as far as the psychology of a people is concerned, where you have this media that's bringing all these external ideas, and it's always about teaching and bringing something, and never about how you extract something from some of these even indigenous communities. So let's say, for example, something like addressing the obesity situation in America. What can you learn from these communities that you're always putting something upon? I don't know if that makes sense.
it makes a lot of sense. And one of the things this reminds me of is we look at the social determinants of health disparities. So we're looking at communities and looking at the way space and place or the environment impact health. For example, and we're funded by the California Endowment, and this is their main focus. We can talk to mothers from now until we're blue in the face about feeding their children healthy foods, having the kids go outside to walk and exercise. If that family lives in an inner city where they don't have access to fresh vegetables or fruits, there are no sidewalks and there are no parks, and it's unsafe for the kids to be out, we're not really getting at what's happening in that community. And so we look at the environment. And to do that, we have to understand, you know, from the inside out, the reality of people day to day. But it gets back to storytelling. We need to have the stories of those people. And in fact, we do. Because of our work, the California Endowment started a story bank. And they went into communities and they started having people tell their stories. And they bring the stories to us at Hollywood Health and Society. And then we set up briefings with writers and producers like Neil, and we take these community stories to them to see if we can inspire them to turn it into a TV storyline. So that's one way we're doing it.
And I met the California Endowment people through Hollywood Health and Society, and so I took my project that I've done in Africa with Venice Arts, and they do it in LA as well. And now California Endowment has 14 cities. They're really focusing on putting all their money into helping communities identify the issues that are affecting them and how to design ways to do something about it. So we gave cameras to kids in Compton, which is in South Central LA, so that they could tell stories about what concerns them, and they could share their photographs with community centers, or at community centers, where they're discussing these issues with adults. And so now we're moving into 7 other cities with the hopes that we'll go into all of them. But these kids are telling their own stories, what affects them, what they're thinking about. And what's interesting is once you have a camera and you have to really look and you're learning about telling stories, and you're not just, we just don't give kids cameras and say, hey, go out and shoot pictures, but we really talk about stories, we show them examples. Once you have a camera, it kind of gives you a way to look at the world, to really focus, as Alcides said, or I think he says in the whole, not in the clips, but in the film, he says, when I got my camera, I started to see my city, Maputo,